everyone. Today is the first class of medical genetics. And in this class, first I will introduce the arrangement of the semester and the course itself. Then 2 questions. The first is, what is medical genetics? The second is, what is genetic disease? In the teachers, me and David Selfen were in charge of lectures. David is a native speaker, and another Dr. Liu, young Dr. Liu, were in charge of lab training. The textbook is bilingual. Why it is bilingual? Because when you come to the hospital, yes, the class will in English, but the patients cannot speak English. So I think sometimes bilingual is useful for you. And the reference, first, Thompson. It is useful because it is classic textbooks. And the second is, in this book is very easy for you to learn it if you can have a quickly look when you want. Exam, presentation, final exam, lab report, and homework. Now I will begin my class. This time I will begin with a story. Several years ago, a young girl, a beautiful girl who is a dancer, came to the hospital because he planned to marry. And the big question is, no menstruation. Why no menstruation? And then the doctor let her come to my laboratory. I did chromosome analysis for her. The result is surprised because she has a Y chromosome. What does it mean? She is a man. Male. If she has a Y chromosome, that means she is a man. But why look like a girl? Then we did the gene analysis for her. The molecular diagnosis showed she is a patient of AIS, androgen insensitive syndrome. This is because of the receptor of androgen. Yes, Y chromosome is okay. Androgen is okay too, but the receptor of androgen mutation happened. The gene encoding the androgen receptor is wrong. So the androgen receptor cannot recognize the androgen and cannot bind with androgen. Androgen does not work. That means she or he look like a female and no menstruation. This is so sad. But the story has a warm end. Her fiancé still loved her and married her, even though she or he is a man. And the story also has a very bad end. That is, her sister is his brother. Do you make sense? Because it is genetic disease, the family member has the same disease gene. That means her sister or his sister is a patient of AIS2. This is some picture for AIS. Another story happened on my student. One of my students, when he graduated from our university and came to the hospital, became a doctor. When they came to my department and asked me, Dr. Liu, can you do chromosome analysis for one of my patients? I said, okay. What's wrong with him? He said, I suspected he is a patient of Klinefelter syndrome. Klinefelter is a syndrome of a chromosome. This is the chromosome type of Klinefelter syndrome. The patient has extra X chromosome. So even he is a man, also the appearance like a female. I said again, ask him why you think he is a patient of Klinefelter syndrome. He said, mania. I surprised. Mania is not a typical symptoms of this syndrome. In this syndrome, the typical phenotype is sexy development, abnormal sexy development. just very few patients with another symptoms like a low IQ, like mania. That means this student has some knowledge of genetics, but did not learn very well. The two stories taught you as a future doctors, you must learn some knowledge of medical genetics, because genetic disease suffer the people. And you must learn it that you can diagnose it exactly and give help to the patient. Disease caused by 3 factors. The first related to environmental stress, just like bird flu, SARS, is no business of gene. And the second type is related or caused by genetic factors. Like this disease, the baby looked like a very lovely girl. It is a patient of Down syndrome. Down syndrome, we call it most lovely syndrome of chromosome, but with low IQ. It is because of aberration of chromosome. Do you know him? Maybe not. This guy is a famous Chinese movie director. He's famous, died 3 years ago. But his family life is a tragedy. Why I say that? He has 3 sons. The first one, the older one, is also smart, also a movie director, but died before his father because of cancer. And another 2 sons, all the patients of Down syndrome with low IQ. And this disease is because of gene mutation. It's named Duchenne muscular dystrophy. Duchenne is the doctor's name who first reported this disease. And dystrophy is a protein located on the muscular cell membrane. Look at this picture. The patient, weak muscles, and poor balance, always fall down. In the lower legs, the muscles look like fat but not strong, also very weak. These two kind of disease are all because of gene factors, genetic factors. The first one is because of chromosome disease. The second is gene mutation. The 3 types of disease caused both of gene and environmental factor. Like jaundice, like ricketitis, are all because of the bad environmental factors made the gene mutation, the development of gene mutation. And also some disease you know very well, like diabetes, like asthma, are all because of gene and environmental. So what is genetic disease disorders? It caused wholly or partly by genetic factors. Then I will answer the first question is, what is medical genetics? It is from human genetics, a branch of human genetics. Like this picture, father and mother, their phenotypes and genotypes will pass down from one generation to next generation. So this is human genetics. Look at these pictures. These phenotypes are of human genetics, and this will be today's homework. For example, like this hairline of forehead. If like this, we call it widow peak. You know, in Chinese language, we do not like the word widow. So in my Chinese class, my students give it a new name, beauty peak. If you have the peak, it is dominant. If you do not, it is recessive. For me, I'm recessive. I do not have the peak. Like this one, tongue ruling. If you can, it's dominant. If you cannot, recessive. Can you? I cannot. I'm recessive. Who can? Nobody? You are all recessive? So today's homework is draw a pedigree in your family. What is pedigree? It's family tree. Family tree. This full phenotype. Please do an investigation in your family and draw a family tree. These are the symbols. Square, male. Round, female. Black in the disease. Black means affected. But in human being, in a normal phenotype, the black one means dominant. White one means recessive. What's this? Proband. Proband is the first one in the family who came to the doctor and who reported to find this phenotype. So in your family, who is the proband? Yourself. Like this is a small pedigree. The first generation, second generation. In first generation, number 1 and number 2. And the mother and the father. Father dominant, mother recessive. And this one is proband, just like that. Family tree. Medical genetics use the rules and tools of human genetics, but the topic is about disease. We have already known disease can be caused by 3 reasons. The first one is none of genetics business because of infectious, because of environmental factors. And the second one and the third one are all related to genetic factors. Genetic factors has three tasks to do. The first is research work about the mechanism of genetic disease. Like this. The disease is Wilson disease. The doctor named Wilson first reported it. And the video will show the symptoms of the patient. Epilepsy, the disease, the mechanism of the disease is because of a gene. The gene named ATP7B, encoding protein located on the membrane of the cell and the membrane of Golgi body. It is like a pump the copper out of the cell. So when the pump doesn't work, when the gene mutation happened, too much copper in the cell, it is dangerous. It will damage the liver cell and neuron. So you look the symptoms like this video. This is the first task of medical genetics, found the mechanism of genetic disease. The second is clinical genetics, including diagnosis and therapy. Diagnosis. Sometimes the symptoms is typical. It's easy to see, like this, albinism. Result black color. The skin and hair are white. So, albinism, it's easy to be diagnosed because the symptoms is typical. And sometimes lab training, diagnosis is useful, like this disease, sickle cell anemia. In lab diagnosis, you can find the sickle cell. This red cell of the patient. This is normal, and this is of from patient. And some red cell like a sickle. And for the birth defect, imaging diagnosis is useful to find the defect. Do you know this woman, Wang Fei, a famous singer of China? And his second baby, is hair lip. When she pregnant, the imaging diagnosis showed the result, but she still decided to have the baby. The third kind is molecular diagnosis. It is now very useful today to find the disease, to diagnose the disease, especially in prenatal diagnosis. Actually, the genetic disease is difficult to prevent. So prevention is difficult, very difficult. Just in few disease, we can prevent the phenotype appear. Look at this picture. It's a whole family, the older sister and the younger. The older sister look stupid, look with low IQ because she is a patient of PKU. PKU is a disease because of the gene mutation, the gene of phenylalanine hydroxylase. And that means the metabolism of phenylalanine is abnormal. So phenylalanine can change to this one, phenylfluvic acid. It is a harmful material, and the phenylfluvic acid can damage the neuron. So the brain development will be abnormal, the patient with very low IQ. Why the younger sister is okay, married with happiness life? Because when their mother had a first baby with PKU, and she pregnant again, the doctor did the prenatal diagnosis for her. And it showed the second baby is also a patient of PKU. What can she do? What can the mother do when the baby born? The food without phenylalanine in whole life. So no phenylalanine and no phenylfluvic acid. In the genotype, the younger sister is PKU, but in phenotype, she is okay. Therapy and consult. In my opinion, because I'm a teacher, I'm a genetic teacher, no therapy of genetic disease because we cannot change the gene. We cannot change the gene. We just can do something about the phenotype, to change the phenotype, to change the symptoms, but we cannot change the gene. So in the medical works, in the doctors who has medical background, so consult is very important. It's very important. In many big hospitals, there is some consultant, professional consultant. This is a picture. We come to the hospital and do consultant for the patient. And this is a teacher of my department, and my students come there too. And the doctor and the mother and the child are the patients. You can give some suggestion when the patients come to you to ask their risk if they have a family history. She or he will ask, how about me? How about my risk to have the disease? Or they will plan to marry, plan to have a baby. You can give them some suggestion. It will be helpful. Then the second question is genetic disease. What is genetic disorder? Genetic disorder is because of abnormality in the genetic materials, DNA. sometimes because one gene, sometimes because more than one gene, and sometimes because chromosome aberration, one chromosome or a set of chromosomes. And first, I will introduce the characteristics of genetic disorders. The first one, it is congenital. It is congenital. Look at this picture. The baby with albinism and the baby with Down syndrome. We all have looked at video before. It is the symptoms with bone, so we call it congenital. Look at the picture. We see it again. Albinism. It is not very clear because it was taken many years ago. So, this disease with bone, these symptoms with bone. The second is mode of inheritance. Genetic disease, the mode of genetic disease is special. Next time is the cause of single gene disorder, and David will introduce it detailed about the gene model, gene mutation model like AR, AD, and X-linked. Conclusion, it is in a family, from one generation to next generation. It is the model. The third is population of distribution. The distribution is always in a family, just in a family. Look like this pedigree, a very large pedigree from Queen Victoria. In their family, there's a genetic disease named hemophilia. Hemophilia is a disease because of gene mutation. The symptom is to bleed and blood clotting. The gene is from Queen Victoria, but she has no symptoms because it's X-linked disease. She just is a carrier the disease gene, but no symptoms. But she passed the gene to the next generation. The beautiful princess with the gene carried the gene and married to another country, to Spain, to Russia, and have some generation with the patient, with the disease. Alexis in Russia, she is a patient of hemophilia, serious patient. But in their family, it's okay. So I think she married a carrier princess to another country, but keep the normal princess and prince in their family. Familiar. Do you remember Duchenne muscular dystrophy? We have already seen the pictures of Duchenne muscular dystrophy, and I told you it is because of a gene of dystrophy mutation happened. This is because of the gene mutation, and it is a genetic disease. Weak muscles and his poor balance when the patient walk like a duck, falls often, and cannot stand with balance step. Then we will see a video of his family. difficult to walk, when walk like a duck, familiar. In a whole family, 5 brothers are all the patients of the Duchenne muscular dystrophy, DMD. Cannot stand up. When he lies down, he cannot stand up because the muscle is very weak. Its pedigree. In a whole family, why only the boy, the male, is patient because of the gene located on X chromosome. We will discuss about next time.